Private equity firms now manage $8.2 trillion. That's bigger than Japan and Germany's economies combined. And in every country where they've run wild, one thing keeps happening. Ordinary life gets measurably worse. I'm going to show you the charts. Here's the setup. Since 2000, the financial sector didn't just grow. It swallowed the real economy. Look at domestic credit to the private sector as a share of GDP. In the US, it went from around 160% to over 190%. In the UK, even more extreme. The Netherlands? Off the charts. This is what economists call financialization. When finance stops serving the economy and starts feeding on it, private equity is the sharpest tooth in that mouth. They borrow cheap, buy real businesses, your hospital, your apartment building, your nursing home, load them with debt, strip the assets, and flip them. The bigger the financial sector gets relative to actual production, the more of this extraction the economy has to absorb. And notice which countries sit at the top of this chart. Remember them, because they're going to show up again in every chart that follows. Now the counter-argument. Defenders of PE love to say, more capital means better services. More money in healthcare means better healthcare. Fine. Let's test it. Here's per capita health spending since 2000. The US isn't just leading. It's in a different universe. Over $12,000 per person. Germany, France, Japan? Half that or less. So Americans should be the healthiest people on earth, right? Watch what happens when I add life expectancy. The US pays double and dies earlier. Life expectancy in America actually fell. Not during COVID alone, but structurally. Meanwhile, Japan, France, Australia keep climbing. This is exactly the window when PE bought up 8% of US hospitals and a third of emergency rooms. Studies from JAMA show patient deaths rise 10% after PE takeover. More money in doesn't mean better care out. It means more extraction. The counter-argument is dead. So where does the money go? Not to outcomes. Here's the receipt. Life expectancy at birth, 2000 to 2023. Japan, 81 to 84. France, up. Australia, up. Germany, up. The United States? Peaked around 2014, then reversed. It's the only developed country going backwards. This is unprecedented in peacetime. Public health researchers point to opioids, suicide, and, critically, a healthcare system optimized for shareholder returns instead of patients. PE-owned nursing homes have 11% higher mortality. PE-owned dialysis clinics cut staff. PE-owned ambulance companies surprise bill you into bankruptcy. This is what happens when you let finance eat medicine. You get a country that spends the most and dies the soonest. Follow the money. If ordinary people aren't getting healthier or richer, someone is capturing the gains. Meet the Gini index. Inequality on a 0 to 100 scale. Higher means more concentrated wealth. The US sits at 41, closer to a developing economy than to France or the Netherlands at around 30. And notice, the countries with the most financialized economies, US, UK, have the worst inequality. The countries that kept finance on a leash, Japan, France, Germany, stayed flatter. This isn't a coincidence. When PE buys a company, the playbook is identical. Cut wages, fire workers, extract dividends, sell. The productivity gains don't go to labor. They go to a fund in Manhattan or London. Over 20 years, that compounds into a fundamentally more unequal society. Final chart. This one is the smoking gun. Household consumption as a share of GDP. Basically, how much of the economy real families actually get to spend. In a healthy economy, households capture most of it. In the US, households still consume about 68% of GDP. But that's propped up by debt, not wages. Compare that trajectory to Germany, Japan, the Netherlands, where households capture less headline share but off higher real wages and public services. The American number hides the truth. Rents up, healthcare up, education up, wages flat. The gap between what households nominally spend and what they actually own has exploded. That gap is where PE lives. It's the difference between GDP growth on paper and GDP growth in your bank account. One went to Wall Street, the other never showed up. Here's the verdict. Private equity isn't a neutral asset class. It's a machine that converts real economies, hospitals, houses, workers, into financial returns for a tiny group of people. The data is unambiguous. The countries that let it run wild have sicker citizens, more inequality, shorter lives, and stagnant wages. The US is not an exception. It's the preview. Every country on this list is drifting toward the American model unless something changes. $8.2 trillion under management didn't come from nowhere. It came from your rent, your hospital bill, your paycheck. The extraction is the business model. And until governments regulate PE like the systemic risk it is, the charts you just saw will keep getting worse. If you want more videos that go straight to the data instead of the talking points, subscribe. No hot takes, no vibes, just charts that tell you what's actually happening to your country.